Dr. Castro, thanks for having us out today.
Yes, thanks for visiting.
And you and I met last year at a endo event in Denver, I believe, right?
That was a fun event, training.
Got what you were looking for out of the training?
Yes, and then some. So I'm still in contact with some of the instructions. When I have cases that I want to kind of get their input, they're always kind of available to answer questions. As practitioners, sometimes we're so set in our ways that adding something new, especially completely new to what we do, it can be a little intimidating. And I like to do things if I know I'm doing it right. Otherwise, I wouldn't do it. And having kind of a big brother, big sister reach out is very important
to a
for
certain
me.
extent.
Yeah.
You bought the laser about a year ago.
Yes.
The Waterlase
Last October, actually.
Right?
Mm-hmm.
So coming up on the anniversary.
Yes.
So first question is, why'd you buy it?
Well, I was reading about it a lot. As an endodontist, we like to be successful in every case we do.
Mm-hmm.
So I was reading about what is something that has improved, that has research, evidence-based, because I'm a firm believer of it, that can help me feel more comfortable. Okay, I'm doing the best for the patients, investing in what is the best. And laser was something that I've been looking at for many years. And I do believe in the technology. And I believe even before I had it.
Right. Mm-hmm. So now that you have incorporated this in your practice, you and I were looking at some case studies that maybe you can talk about some of these examples of how it's changed how you do endodontics.
Well, in many things, it helped me to be more confident when some of these difficult cases that have large lesions, I could do in one appointment. When I have a technology that helped me clean farther where my instruments go or my irrigants go, then it helped me do probably a little more cases on a one appointment that before I probably would not even dare. It has changed how I see endo, because then I'm looking for what else am I going to see on my final x-ray, right?
So your patients, do they know that they're being treated with a laser?
Yes, yes.
And how do you communicate that to
I
them?
always explain, this machine that we have here will help me get to that big infection that you have in your bones, because their question, usually when I see them, I don't see, oh yeah, little decay went into the nerve tooth. I see big abscesses, lesions, and I explain, this is a laser. I point at the little pin. This is what it's going to do. It's a radial, so it doesn't clean just straight, it cleans around. So I kind of explain to them so they see the value of what we're doing, and they're more comfortable that way. I had one patient that just called us for an appointment, and I saw her a couple weeks ago. She's like, well, I have a friend who knows about lasers, and he told my husband, no, if she's gonna need a root canal, she's gonna have to go to a place where they have lasers. So she's like, I Googled you, and then I saw that you have the laser. So that's what she ended up here. That's the first one that I see that she took the initiative.
She seeked out you
yes.
because of your adoption of this technology.
But once I explain to the patients, they feel more confident on taking the option of trying to save their teeth.
Right. So I know you've only been using the laser for about a year.
Yes.
Is that soon enough where you've seen patients come back and after a certain amount of time that you see some improvement?
I have seen some that I'm like, oh, this is probably gonna be surgery, right? And I prepare the patient. I usually do 6 months and 12 months recall, and I have a fairly good amount of patients coming back for the recall. And I have some that had already had the 6-month checkup, and I've seen some bone growth, and they're coming for the 1-year checkup. Right. So I've seen those that I'm like, okay, we're not even gonna talk about surgery anymore. We're gonna give another few months, reassess, and probably not even do surgery at all if it heals. But I've seen those cases.
Yeah, that's certainly some great stories, and thanks for sharing those with us today. And more than anything, thanks for being part of the Waterlase family. We appreciate you so much, and I love following your kind of laser journey over the last year.
Yes, I am very thankful. I think it makes my practice more fun. I love endodontics, so it makes me enjoy more, and I just love it. It's easy to use, not time consuming, and I can see already the difference in my cases.
Well said, much appreciated. We're so glad that you're a customer of ours. Thank you. It's good seeing you again.
Good seeing you too.